Hello friends, myself Mr. Sachin Kumar Pandey, and in this video we are going to study about easy tricks to remember all the schedules to the rules in jurisprudence. This topic is important for D Pharmacy, B Pharmacy students. Along with it, always around 2 to 3 questions are asked in your GPAT examination. Besides, it is important for NIPER and DI examination. So now starting with all the schedules. So schedules are as per in alphabetical orders. So schedule A is for application. Okay, so A for, you can remember this like A for application. So schedule A states about list of forms used for making application for issuing license, granting license or sending memorandums. Schedule B is about fees. So definitely you can remember like only filling of application is not enough. Along with application, you are also required to pay fees. So Schedule B is all about fees for test or analysis by the Central Drug Laboratory or government analyst. Schedule C is for biological and special products. Schedule C1 is for other special products. Schedule D is exempted from provision of import. You can remember this like K.D. Tripathi, right? The very popular book of ecology. So, Schedule K and Schedule D, both the schedules are exempted. So, here Schedule D is exempted from provision of import. Schedule E is omitted. However, this schedule was for list of poisonous substance. Schedule E1, E, right? That is, you can, this E means no one will like to take poison very happily, right? So that sense is E. That is something which you do not like, right? So E is list of poisonous substance under the Ayurveda, including Siddha and Unani system of medicine. Remember, Schedule E, which was about list of poisonous substance, has been omitted, whereas Schedule E1 is for poisonous substance under Ayurveda, Siddha and Unani system of medicine. Then comes Schedule F. F for fruits, right? So fruits related to blood. So Schedule F prescribes or states provisions applicable to blood bank requirement and license to process blood component. Then after Schedule F we have Schedule F1, F2, F3 and double F. So Schedule F1 is again divided into 4 parts. You can remember it as Vadgaon, right? So Schedule F describes, part 1 describes vaccine, part 2 describes antisera, part 3 describes your various diagnostic antigens, and part 4 is about general other products. Okay, then the next one is Schedule F2. Schedule F2 is for standards for surgical dressing. Schedule F3 is about standards for umbilical tapes. Then comes double F. Okay, so double F states standard for ophthalmic preparations. You can remember this like double F, we have two eyes, right? FF, that is 2F are there indicating your two eyes. Okay, then next one is Schedule G. So G for guidance. Okay, guidance, that is nothing but supervision. So Schedule G states list of substance that are to be used only under medical supervision or medicinal supervision under their guidance, and which are to be labeled accordingly. Then next one is Schedule H, H for handwritten. So that is list of prescribed drug which are to be sold by retail and only on prescription of registered medicinal practitioner. So these drugs are to be sold only after receiving prescription, that is handwritten prescription from registered medicinal practitioner. Then is Schedule H1. So H1 again handwritten, right? So again handwritten prescription. However, this is for drugs, mostly antibiotics and habit forming drugs. Schedule I was about calculation of proportions of poison. However, it has been omitted. Then the next schedule is Schedule J, J for Jadoo, right? That is those diseases and ailments which cannot be claimed to be cured. Okay, so even if the medicines are taken, however, assurance cannot be given that this respective disease can be cured or prevented. So, if there is any sort of jadoo, then it may get cured or it may even not. So, J for jadoo. Next, K. Again, K, D, Triparty, K and D are exempted. So, Schedule K is exempted from provisions applicable to manufacturing of drugs, whereas D was exempted from provisions applicable to import of drugs. Okay, so certain drugs which are exempted from provisions applicable to manufacturing of drugs are included in Schedule K. Schedule L is again omitted. L was about list of drugs to be sold on prescription only. Then Schedule L1. L1 is about L for laboratory, right? So L for laboratory, this schedule is about good laboratory practices and requirement of premises and equipments. Okay, Schedule M. So M for manufacturing, good manufacturing practices. L for laboratory, good laboratory practices. L1, right? Because L is omitted. L1, good laboratory practices. Schedule M for good manufacturing practices. M1, M2 and M3. Your M is further divided into these three different types of schedule. So you can remember this by HOD. Okay, so H, that is homeopathic. O, you can write it like HOD. Then just behind O you can add C, and before D you can write M. This is in order to remember. So you can easily remember HOD. So H for homeopathic medicines. O, just add C before O, so it will be cosmetics, and before D you are going to add, or we are going to write M, that is medicinal devices. So schedule M1 is about good manufacturing practices and requirement for manufacturing of your homeopathic medicine. O is in manufacturing of cosmetics, and D is in manufacturing of medicinal devices. N for need, right? So N is about list of minimum equipments for efficient running of pharmacy. Then comes O. O, very resembling to that of 0. Nowadays you can see many of the advertisement on television. Disinfectant, right? 100% clear from all sort of bacteria, viruses, etc. So how much left? 0. So this is about standards for disinfectant fluid. It is again divided into two parts, part 1 and part 2. Part 1 is applicable to provisions applicable to black fluid and white fluid, whereas part 2 is about provisions applicable to other disinfectant fluids. Then After schedule O, we have P. P for period, right? So period of drug, lifespan of that drug. P1, so P1, first alphabet A, that is PA. So pack size of drug. So P1 is about P1, first alphabet A. So PA, that is pack size of drug. Then is schedule Q. So schedule Q is about list of coal tar colors permitted to be used in cosmetics. It is again divided into two parts, part 1 and part 2. Part 1 is about list of dyes, colors and pigments permitted to be used in cosmetics and soaps, and part 2 is about list of colors permitted to be used in soaps. R, R for next schedule, R for your rubbers and latex, right? So R for rubbers, you can remember this, R for rubbers. So standards for condoms made up of rubber, latex intended for single use and other mechanical contraceptives. Next is schedule R1. Okay, so this is IS as per Indian standards laid down from time to time by Bureau of Indian Standards for Medical Devices. So here it is R1, right? 1 resembling very similar to I. So IS according to Indian standards laid down by Bureau of Indian Standards for Medical Devices, that is in your schedule R. Schedule S is for, S stands for cosmetic. You can remember this like S, Sundar, right? And for appearing Sundar, for appearing beautiful, what is required? Cosmetics. So schedule S is about standards for cosmetic laid down time to time by Bureau of Indian Standards. Schedule T, HTC, right? You know this popular brand. So HTC, requirement of factory premises and hygienic conditions for Ayurveda and Unani drugs. HTC, hygienic in schedule T conditions. Then schedule TA. TA is forms of record of utilization of raw material by Ayurveda or Siddha or Unani licensed manufacturing units during the financial year. So all that details has to be provided in schedule TA. Then the next schedule is schedule U, right? So whenever it comes to part of documentation, right, any of the analytical record, we try to skip out of it. So we always say you do. Okay, so schedule U is about particulars to be shown in manufacturing, raw material and analytical record of drug. So you can remember this, the part which you don't like, you do, right? So you do documentation, analytical record, everything. Then is schedule U1. So U1 is again all the same records and everything that are to be shown in respect to cosmetics. Then comes schedule V. We want patents. Everyone wants patent, right? So schedule V. So you can remember this like definitely what we all want. We all want patent. So standards for patent and proprietary medicines. Schedule W. W is like list of drugs which are to be marketed under generic names only. Then comes schedule X. X indicates danger, right? So wherever there is danger, the sign X is mentioned. So it is list of habit forming and narcotic drugs. Schedule Y. So why clinical trials? So schedule Y is about requirement and guidelines on clinical trials for import and manufacture of new drug. So this is how you can remember all the schedules. Few of the important points. Schedule D is exempted from provision of import and Schedule K is exempted from provision of manufacturing. Also, it was June 22nd, 1982 when Schedule E, I and L were omitted, Schedule G and H were revised and Schedule X was introduced. In 1988, Schedule M incorporating good manufacturing practices was amended and Schedule Y, that is pertaining to clinical trials of new drug formulations, was incorporated. In 2000, Schedule T of Ayurveda, Siddha and Unani medicine was introduced. Hope now it will be easier for all of you to remember all these schedules. So, thank you very much. Do like, share and subscribe my channel. Thank you.